Bonjour, good afternoon. My name is Sean Work. Welcome, and I know a lot of people are going to be filtering in here. First, I'd like to really start off this session, at CAHR here. It's a real special honor to be part of this amazing group here, but just wanted to first acknowledge and pay respect to the Indigenous people across the territories who are the traditional stewards of this land we're on today. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people from all nations, including Inuit and Métis people from across Turtle Island who call Canada home. We'd like also pay respect to the ancestors, current knowledge holders, including elders, and non-human relationships that contribute to healthy environments such as animals, plants, water, and soils. So, thank you. I have the great pleasure to be here. These are the 12 champions that are going to talk with you today about their experiences with this rollout. We're very excited on August 1st, the Minister Duclos announcing with the Government of Canada funding support HIV self-testing. And we have really been rolling it out over the last 5 months, and it's going very well. And we're really excited that the government is now investing in this for the next year. These are the trailblazers. It's really exciting to, the community-based response has always been and always will be the way to actually move forward and reach everyone who needs to get testing, treatment, access to care. And so this is really a pleasure for all of these people to be here with us today. We're actually paying attention to how this is evolving, and on the right-hand side, you'll see how we're doing. The purple circles are where tests are being distributed actually one-on-one, and the green are circles that represent where testings are being distributed in events. Great numbers, huge advances that is happening in reaching people who are undiagnosed, and we're currently distributing 200,000 tests, 84,000, you see 261 agencies are involved, and so on. So with that, we have these incredible champions. Each one of them is going to give you a pitch for 3 minutes, and you're going to hear about what they're doing, where they're doing it, how it's working, and then at the end, we'll have some time for questions. And just before I turn it over, I just want to acknowledge these are the champions. We have a superhero. Kristen McLennan is somewhere in the room here. If you can stand up. If it wasn't for her. So thanks, Kristen, on behalf of myself and the team here and everyone. We couldn't do this without you. So with that, I'm going to turn it over to Brooke to start us off. Thanks, Brooke.
Thank you, Sean. So I'm Brooke Begin, the Director of Programs and Education at CBRC, a national organization supporting the health of queer, trans, and two-spirit people. I'm going to speak about a couple of our HIV self-testing distribution programs and then hand it over to my colleague, Jesse. So the first program is our Test at Home program. It's a national mail order program. Two-spirit, queer, and trans people from anywhere in the country can order HIV self-test from us, and we'll ship it to them free of charge. It's super low barrier. There's no registration. We don't ask for a lot of personal information. It's like ordering a product from Amazon, except we provide you with peer support, both before, during, and after the test for any who request it. In the first 4 months, close to 6,000 tests have been distributed through the program to about 1,600 people. We usually encourage people to request more than one in case of an invalid test result or for follow-up testing or to share with other people in their networks. Some key learnings so far is that, there are signs that we're reaching the people we intended to reach. And so of those who completed an optional post-order program survey, about 80% indicated at least one HIV risk factor, and about half of those had not been tested at all in the last 12 months. While not confirmed through confirmatory testing, of those who reported their results back to us, 2.3% did have a reactive test result. And what's really cool is that about 40% of people who told us what they did with the kit shared it with others in their network, helping us reach people beyond those that are connected with groups like CBRC. And maybe the most exciting thing about all of this is that the community seems to love it. So about 91% are very satisfied, 98% are satisfied overall. And you can see through the quotes there, the things that people mention are, ease of use, reduction in stigma and anxiety because they can do it in the comfort of their own home. And the second program I'll speak with you about is the Test Now program. And so CBRC supports a network of about 40 community-based organizations, businesses, and venues across the country who are distributing kits to queer, trans, and two-spirit people. While we provide support, it's really up to each group to determine how they want to do this based on their local context and the audience that they're trying to reach. So far in the first 4 months of that program, about 5,000 kits have been distributed to over 3,000 people. And some key learnings from that are that, we're really seeing high interest from a diverse group of partners. And some of the most successful partners with this program aren't HIV organizations or health organizations, but are queer bars and pop-up parties and businesses and pharmacies. And so I think that teaches us that we can really expand the network of partners that we invite in to do this work. We're also finding that there's no one right way to do this. Each of our partners have a unique way of distributing these kits, and many are successful. And so there are multiple paths to reaching the people that we want to reach through this type of work. And lastly, there's a great deal of value in a targeted outreach approach. And so while we're quite pleased with the diverse audiences that our national mail order program is reaching, when you look at key groups that we're trying to reach, like Black, queer, and trans people, Indigenous and two-spirit people, the greatest deal of success happens when we invest in and empower groups within those communities to lead the work. And on that note, I'll pass it to my colleague Jesse to speak about the medicine bundle.
Fast, Brooke. Hi, everyone. Jesse Dame, very proudly Two-Spirit and Métis. My family is originally from Treaty 1 and Treaty 2 territory, which we colonially know as Winnipeg and St. Roselac, but I currently live in Vancouver among the CATIE, Kwantlen, and Semiahmoo First Nations. And I'm very proudly the Two-Spirit Program Manager at CBRC. So very quickly, I'll go over one of our major successes and one of the beautiful projects that we were able to work on over the last 3 years. So the Medicine Bundle pilot, or now the Medicine Bundle, was a community initiative. So we did a bunch of consultation about 3 years ago where we went into community within the Two-Spirit, queer, and trans communities throughout BC and had great conversations about what's going on, what is needed in our community the most. And one of the biggest areas identified was around sexual health and sexual health care access. So through those conversations, we came up with, in community, the Medicine Bundle, the Medicine Bundle pilot. The concept itself is as old as time, but the concept that we went forward with was to include sexual health and harm reduction supplies in that Medicine Bundle to really address the spiritual, emotional, and mental aspects of healthcare within the testing pilot. So through community, we were able to connect with folks about what is needed in the Medicine Bundle, what do folks want to see in the Medicine Bundle. So through that, we were able to put together, a medicine bundle. So within that was a number of different traditional products on the West Coast. So sage, sweetgrass, Labrador tea, Devil's Club, salve, bear grease, as well as internal external condoms, quality lubricant, HIV self-test kits, and in the original pilot, DBS test kits as well as direct connections to care. So we had our own Trusted Messengers program where we had Two-Spirit, queer, and trans Indigenous folks and Indigenous women throughout the province supporting this pilot at home and in their own communities so folks could access it. And it was really our approach to try and challenge stigma in community around sexual health, and that all folks should have access to sexual health care, whether they're having sex in a bathroom stall or in their own bedroom. We should be able to give them the tools that they need to have sex the way that they would like. So the major learning or the research goals were to learn about barriers and access limitations to sexual health resources. So we did that through consultation, and then through majority of the work, we're able to have amazing conversations about what does challenging sexual health stigma in community look like, and how is the Medicine Bundle gonna do that. One of the biggest barriers we found was access. Of course, BC is a big province, but there's lots of limitations to rural and remote communities. So how are we addressing that? And part of that was through folks going online, ordering the medicine bundles, being able to pack the medicine bundle themselves, and then we ship them in discrete packaging to their own houses. And then lastly, as I said, the sexual health campaign that was a big part of the medicine bundle was really about bringing the sacredness back to sex, challenging that sexual health stigma, using folks in community, Two-Spirit, queer, and trans folks throughout the province of BC to really bring that messaging so that we could see ourselves in the materials to increase that access to sexual health testing and STBBI care. Thank you.
Hi everyone, I'm Selena Kennedy-Yadam from Ribbon Rouge Foundation. At Ribbon Rouge Foundation, our goal is to achieve health equity for African, Caribbean, and Black people and those who are not ACB. So for our test distribution experience, what we have done, what is unique about our experience or our method is that we kind of do it in an engaging and interactive way. And how is that so? We try to make it culturally appropriate within the ACB communities, and we talk about HIV in an informal kind of way instead of a serious way to kind of try to break down the stigma in the community. And one of the major platforms that we've used is church to create education and awareness, and we've realized that doing that, it makes people kind of relaxed. And one of our key distributor within the community is a faith leader, because within the ACB communities, we revere our faith leaders and elders in the community. And because as a result of that, we've seen a lot of successes with our approach. And one thing that we are seeing is that there is a lot of reception if it's coming from their faith leader in the churches, and also a lot of reception within the ACB communities and association to take up the self-test kits to know their HIV status. And as a result, we've seen an increase in requests because we are breaking down the stigma, which is very critical, because within the ACB community, sex is normally a taboo, and we try to break away the stereotype thinking that HIV is mostly among people who are promiscuous that get the virus. And we are seeing that there is a demand for people. We know that the outreach is working, and we are gradually breaking the barrier of stigmatization due to the demand for PrEP, prevention, and also people asking for care and support, and how it intersects with other health and related infections. Every successful program has challenges and barriers, and we've seen one of the key challenges I like to talk about is the misconception about HIV, particularly among married women in the ACB communities. They think they are immune to that because they are in a one time of relationship, so it's for people that are promiscuous, and it's making it very difficult for us to get access into the community, especially if they are the elders or the gatekeepers of that community. But over time, we are hoping to break that barrier. Thank you.
Hello, bonjour. The national average rate of HIV is 4.5 per 100,000 people, while in Saskatchewan, it is 20.3 per 100,000 people, which is about 4 times the national average. The highest number of HIV cases are reported among people who inject drugs. AIDS Program South Saskatchewan operates one of the busiest needle exchanges in the province. APS has provided the HIV self-test kit to people where they are, and to increase the low barrier access to HIV testing to people at the highest risk of HIV. So the COVID pandemic severely impacted the number of people who had access to HIV testing. And in 2021, APS has requested a community nurse and a phlebotomist to offer HIV testing along with the hepatitis C testing at the needle exchange. So from June 2021 to March 2022, we had 102 HIV self-test kits that were performed, with 26 indicating a positive result. Of the 26, 7 were new diagnoses, and 18 individuals were connected to CAHR. APSS conducts monthly surveys in the needle exchange to gauge behaviors and risk factors related to HIV and hepatitis C, as well as substance use toxicity. Before the availability of HIV self-test kit, when surveys showed that people had not been tested for HIV or had shared needles, they were directed to go to a health clinic or to return when a healthcare professional was available at APSS. Most of them did not follow through on this, and this was a lost opportunity. With the availability of HIV self-test kit, APSS has been able to provide education on usage and confirmatory testing, resulting in 4 people who had taken the test kit in the last 2 months returning to do confirmatory testing with our healthcare professional. APSS also provides HIV education and peer support in Regina and in southern Saskatchewan. The success of APS's HIV self-test distribution can be attributed to education, the ease of use, the privacy and confidentiality for the test taker, especially in the smaller towns in southern Saskatchewan. And compared to the pilot project done in 2021, we found that the First Nations community were more receptive to accepting the HIV self-test kit. However, cultural barriers and stigma prevent individuals from some communities, including the Asian, East Asian, Middle Eastern, Caribbean, and Black communities, from accessing the self-test kit due to practices that are considered taboo in these cultures. So to sum up, like a story that one of our clients who had taken 5 self-test kits, one was for her and 4 others were for the working girls. She had commented on the ease of using the self-test kit, and we reiterated the importance of staying safe, of regular testing, and of confirmatory testing if the tests came back positive, and to see our healthcare professional for connection to CAHR. Thank you.
Hello, my name is Kyle LaBelle, and I work as a sexual and reproductive health facilitator in Winnipeg for CIRC Manitoba. From April 2022 to March 2023, we piloted a harm reduction program for the party and play community titled Peer and Peer. This project was funded by SUOP in partnership with the Community-Based Research Center, and similar programs were or are being run in Edmonton, Ottawa, and Halifax. The goal of the project was to develop harm reduction services tailored to the unique needs of those engaging in sexualized substance use. We delivered safer sex and drug supplies once a week to folks' homes, as well as offering pickup and mail-out services. Building the HIV self-test kits into the P&P program led to a quick uptake of distribution. In the first 3 months, we distributed about 500 test kits. Advocating for the integration of the kits into other facets of CIRC's work has been helpful, as well as encouraging other organizations in our network to do the same. We have also had success with reaching out to businesses and offering the kits for their space. By adding some simple branding to the kits, we have also had new organizations reach out to us to request them. So part of what has made kit distribution successful for CIRC is having built it into our harm reduction supplies project and being able to offer mail and personal delivery options. The delivery and mail options made our kits much more accessible. Building and nurturing relationships with businesses and other community spaces has also been hugely important. Getting kits into spaces where community already gather greatly increases accessibility. Some of the barriers that I have noticed are that some folks may be unsure about making these self-test kits available. This may be due to worries that a person won't get connected to pathways of care, or that folks may not seek out a full STBBI screening. My response to these concerns is that the autonomy that these kits allow is critical. We should not be gatekeeping this sort of access to personal health information. The more available test kits are, the more likely folks are to know their status. It is also not up to us to pressure people into connecting to pathways of care by withholding access to tools and information. It is important to trust people, to know what is best for them, and to know that they will access the care they need if and when they want it. Another barrier that I came across is that we were doing deliveries in the winter, and so the kits would sometimes be left outside people's homes for some period of time. We let folks know that they needed to be kept between 2 and 30 degrees, but this sometimes probably wasn't possible. And lastly, the mail and delivery options for the Peer and Peer program are currently unfunded while we look to secure more funding. So this, of course, reduces the accessibility. But in the meantime, we continue to offer harm reduction supplies and test kits for pickup, and we are developing other means of integrating the kits into our programming. Thank you.
Okay, perfect. Hi, everyone. My name is Mary Adego. I'm a prevention coordinator at the Black Coalition for AIDS Prevention. Within my role, I'm also one of the African Caribbean Black strategy workers, and we have strategy workers across Ontario. Since 1989, the Black Coalition for AIDS Prevention has been one of the largest AIDS service organizations that works specifically with African Caribbean Black populations in Ontario, and our motto has been, because all Black people's lives are important. So I'm going to talk to you a little bit about what's been unique about the distribution of the self-test kit. We've been able to incorporate the distribution within a couple of campaigns that were targeted at ACB communities. One campaign was specifically targeted at ACB women. So I'll tell you a little bit about the CAHR Collective. The CAHR Collective is brought to you by ACHO. which is also a groundbreaking campaign whose objective is to encourage ACB women to know their status by incorporating regular testing into their radical self-care practices. So this here is a photo of an event that we did in collaboration with an organization called Sacral Seduction, where we had like a really great panel discussion with ACB women. There was a great dance class, some nutrition, a presentation on like healthy nutrition, and we were also able to promote the HIV self-test kit. The next campaign is a campaign called, it's a Starbucks campaign that focuses on ACB. Well, this particular poster focuses on ACB communities. The National ACB Steering Committee had the opportunity to partner with Starbucks, Black Partner Network, and Pride Committee to have a conversation with roughly 100 100 Starbucks employees to just to highlight the importance of HIV testing, to have them help us promote the IAM website as well as the HIV self-test kit throughout all of their stores. We hope that the rollout continues and the reach is wider. I think one of the biggest successes we've had with the distribution of the self-test kit is within Be Well clinics. I just want to make sure I don't mess this up. So Be Well is a collaboration of local community non-for-profit organizations dedicated to fostering positive interactions with ACB populations. And we've done this in collaboration with many different service providers, close to 40 different service providers who work with ACB populations in Toronto. I think what's been successful about these clinics, they're monthly clinics. We're able to incorporate the uptake of HIV testing while people are getting a mammogram, while they're getting their blood glucose tested, while they're getting on-site HIV testing by Women's Health and Women's Hands. So we've been able to incorporate this into folks like overall health and wellness. And so I feel like the uptake at these clinics has drastically increased since the launch of Community Link. Some barriers that we continue to face are cultural, religious barriers, stigma, and also language barriers. So in the future, we hope that the test and the instructions will be offered in more languages outside of like English and French. And that's it. Thank you.
Hi everyone, my name is Orit. I'm here on behalf of Women's Health and Women's Hands Community Health Center, and I'm here to talk to you all about our successful distribution of hundreds of HIV self-test kits. So our incredible, strategically structured, peer-led outreach team is what led us to this success. The team consisted of a woman in her late 50s living with HIV, a young Black woman who had recently graduated from university, and a middle-aged Black woman who has a lot of experience working in the HIV sector and has experience in outreach programs. The team was able to develop and foster connections in varying sectors and establishments consisting of universities, colleges, local restaurants and pubs, churches, and many other community institutions. The majority of our HIV self-test kits were distributed at local community events where we provided brief, culturally safe speeches talking about the kits, its benefits, and its importance within our community, particularly given that the ACB communities are disproportionately affected by HIV and AIDS. This speech would pique the interest of the event goers and brought them over to our table, where we distribute the kits in Black reusable bags, which not only concealed the kits, but also consisted of other goods for them as well. So our peer that was living with HIV would actually use these varying outreach opportunities to share her story about living with HIV. This strategy was particularly useful when discussing the importance of testing and knowing one's status as early as possible. Having a peer that's open about her status not only addresses stigma, but was also an opportunity to show that early detection allows for a long and healthy life after HIV diagnosis, since this peer in particular has been living with HIV for the past 28 years. So in an effort to curb HIV testing hesitation, which was one of the major barriers that we faced, we created a clear care pathway. This consisted of adding a phone number to each and every kit, which led to a dedicated line where folks could speak to a HIV counselor that works at Women's Health and Women's Hands, who was and continues to provide pre- and post-test counseling and many other HIV-related supports. Additionally, having a team of peers that the community could relate to and felt comfortable around helped address feelings of hesitancy, loneliness, and stigma. There was someone of essentially every age group on the team, and since we were all part of the ACB community, this allowed folks to feel more comfortable approaching us with any questions they had and allowed them to feel more encouraged to take kits for themselves as well as for their friends and their family members. Thank you.
Hello, everyone. My name is Michael Birch, and I work at Maggie's Toronto. I'm their HIV and harm reduction program co-manager. Maggie's is one of Canada's oldest by and for sex worker advocacy and support organizations in the country. Since 1986, we've supported sex workers in Toronto, Ontario through drop-in programming, safer sex and harm reduction programming, legal supports, food security efforts, political advocacy, and peer support groups. We are not an exit organization and fight for the decriminalization of sex work in Canada. Prior to the launch of Community Link, Maggie's had partnered with CAMFAR and Sex Fluent in distributing over 282 Insta-Home HIV self-testing kits at our special events, including our World AIDS Day Ball on December 3rd. To date, Maggie's has distributed over 285 kits since December 12th as part of the Community Link program. Like any new program, there are challenges and benefits. In regards to challenges, distributing kits, there are a few. Our encounters with service users are generally brief, and folks in community aren't always familiar with this new testing technology. Some folks do not want to know their HIV status. Folks are already engaged in regular HIV testing with their care provider or are on PrEP. Folks don't want to take the survey connected to the kit distribution, or there's administrative challenges, things like buying and setting up the tablets, training staff and volunteers, setting up tracking tools, incorporating distribution into existing programs, and so on. In general, the same challenges that exist with other forms of HIV testing continue to exist with these kits. Linkage to care, treatment, and support is an ongoing concern, as is the threat of HIV criminalization. However, that being said, I believe that the benefits far outweigh the challenges. Requests for HIV testing is our #1 requested service, especially in bathhouse settings. And this program allows us the ability to now provide that service to our service users. Kits are not generally available for purchase in the area that I work, so being able to distribute these kits for free is a huge boon. And offering these kits has been a great jumping off point for engaging sex workers in conversations around STBBI testing. What I generally want to instill on you is that there's a huge excitement with the sex workers that I work with in regards to this testing technology. Sex workers test frequently, and they want access to frequent hassle-free testing, and this kit does that for them. I can't tell you how many times since December I've been involved in workshops, giving workshops, and incorporated a section or a portion of my presentation to talk about these kits, this new testing technology, and had my entire workshop derailed by the excitement in the room and had to spend 20 minutes talking to people about it. So thank you very much. I'll leave it there.
Bonjour, hi. Je me présente, je suis Pascal, je suis à la coordination du MIELS Québec qui est ici même dans la capitale nationale. Donc nous, au MIELS Québec, on est un organisme communautaire qui œuvre auprès des personnes qui vivent avec le VIH, mais aussi on a une grande partie de notre mission qui est de faire de la prévention, de l'éducation et de la sensibilisation auprès des populations qu'on va dire clés, donc nos hommes gays, bisexuels ou les hommes ayant des rapports sexuels avec d'autres hommes, les personnes qui viennent de pays où le VIH est endémique, les personnes autochtones et aussi les utilisateurs de drogues injectables. On distribue la plupart de nos autotests ici par notre ligne Info VIH. Donc, les gens peuvent nous appeler ou communiquer avec nous par un texto anonyme, le WhatsApp ou par les réseaux sociaux. Donc, ils nous font une demande d'autotest, posent leurs questions. On peut par la suite les accompagner quand ils vont venir chercher leur autotest directement dans nos bureaux, à faire l'autotest avec eux, faire du counseling, parler de dépistage complet, parler de prévention plus at large avec ces personnes-là. On fait également des kiosques de sensibilisation dans les bars de la région, dans les écoles comme les universités, les cégeps et les organismes communautaires. On a aussi décidé, il y a quelque temps, de faire une campagne de marketing social dans laquelle on parle justement de l'autotest VIH. Donc, cette annonce-là, on l'a faite principalement par les réseaux sociaux, mais aussi sur les sites de rencontres pour les hommes gays, bisexuels ou les hommes ayant des rapports sexuels avec d'autres hommes. Et puis, depuis le 3 avril de cette année, vous pouvez voir même à l'extérieur juste du congrès ici, cette même affiche qu'on voit sur les abribus. Donc, ce que ça l'amène, c'est que les gens nous téléphonent « Hey, j'ai vu ça sur un abribus, c'est quoi? Qu'est-ce que ça fait? » Et bien, ça nous permet justement d'en distribuer davantage, mais aussi de partager l'information et de faire beaucoup du bouche à oreille. Le principal problème qu'on a eu dans les derniers temps avec les autotests, c'était même pas l'autotest même, mais plus l'accès à la technologie, parce que quand on a commencé à en distribuer au niveau des populations plus vulnérables, c'est pas tout le monde qui a accès à Internet, c'est pas tout le monde qui a accès aux applications, le téléphone. Donc, on a décidé d'aller faire un peu du outreach. On est allé dans les organismes où les gens étaient plus vulnérables. Si on pense à l'Aubrivière ici à Québec, qui est un milieu pour les personnes itinérantes, donc on est allé dans ces places-là pour aller chercher ces personnes-là. On a aussi, comme je disais, pris l'initiative de prendre du temps avec les personnes pour faire les autotests. Donc, on les accompagne de A à Z. C'est eux qui font l'autotest avec nous, puis on les accompagne, on les aide à gérer un peu leur anxiété par rapport à tout ça. Puis, pour la population plus générale qui ont des questions, bien, c'est sûr que sur notre site Internet, il y a toujours le Frequently Asked Questions. Fait que vous avez toutes les informations sur notre site. Puis, on a aussi des pères aidants qui peuvent aider beaucoup à aller chercher certaines communautés ou certaines personnes qu'on va dire plus méfiantes pour les amener à faire des tests d'autodépistage. Puis, enfin, ce qu'on a appris vraiment de la dernière année, c'est que plus on simplifie l'accès aux gens, plus qu'on leur donne des options, par exemple, soit avec l'application WHIWH ou avec le Community Link, plus qu'ils ont d'options, plus que c'est simplifié, plus que c'est facile d'aller chercher ces gens-là pour faire des autotests, puis de continuer, bien entendu, de faire de la promotion, dite plus active, donc le outreach, par exemple. Merci.
Bonjour, mon nom est Gabriel, je suis coordonnateur au développement chez Réseau. Ancré dans la santé globale, la mission de Réseau, c'est la prévention des ITSS et du VIH chez les hommes qui ont des relations sexuelles avec d'autres hommes. Je vais dire GBRC, donc hommes gays et bisexuels, plus hommes qui ont des relations sexuelles avec d'autres hommes. Alors, je vais vous parler de notre expérience. Bien sûr, le travail de proximité ou l'outreach, comme on dit en anglais, c'est quelque chose qui est au cœur de la mission de Réseau. C'est un mode de distribution, d'ailleurs, que nous avons rapidement mis en place, que nous avons rapidement développé. Par exemple, chez Réseau, on fait des blitz de distribution dans les bars, dans les saunas du village gay de Montréal. On est également présent dans les lieux de party fétiche, par exemple, pour distribuer les kits d'autotest pour le VIH. Un autre des principes importants chez Réseau, c'est l'autonomisation ou l'empowerment, comme on dit en anglais. Nous croyons que, en fait, offrir un accès facile aux autotests du VIH, c'est une façon de donner le pouvoir d'agir et de savoir entre les mains des personnes. Même si on est parfois tenté de prendre en charge les personnes, d'offrir beaucoup d'informations, tout le monde n'est pas nécessairement réceptif à cette information-là, donc il faut y porter attention et surtout, il faut s'adapter, donc adapter notre intervention à la personne qui est devant nous. Toujours se rappeler aussi que n'importe qui peut commander sur le site web du fabricant un kit pour l'autotest du VIH et n'aura aucune discussion avec un intervenant communautaire, par exemple. Sur la prochaine diapositive, je vais vous parler un petit peu là, des défis et bien sûr des succès qu'on a rencontrés dans cette expérience-là. Alors, un des succès de réseau, c'est la mise en place rapide là, de la distribution événementielle. Donc, grâce à nos partenariats actifs avec les établissements locaux et des organisateurs d'événements. Un autre de nos succès, c'est l'intégration de la distribution de l'autotest VIH aux activités régulières là, de l'organisme, qui s'est fait aussi assez rapidement. Du côté des défis, donc, on a pu observer que la distribution événementielle au public peut entraîner souvent des difficultés là, dans la façon d'avoir une discussion un peu cohérente et vraiment qui est informative sur le VIH dans un cadre public avec des personnes qui parfois peuvent être intoxiquées. Donc, c'est un défi qu'on a rencontré. Un autre défi, c'est le fait que les kits d'autotest VIH sont parfois encombrants, doivent être conservés à certaines températures. Donc, on a remarqué là, que certains utilisateurs trouvaient le transport pouvait être un obstacle. Sur la prochaine diapositive, bien sûr, la distribution de l'autotest VIH, c'est un work in progress. Alors, à travers cette expérience-là, on a appris, on apprend toujours. Donc, même si on travaille habituellement en équipe, intégrer la distribution de l'autotest à nos activités régulières nous a amené à améliorer notre travail d'équipe. Puis la distribution de l'autotest nous a également amené à remettre en question nos méthodes habituelles. On pense donc qu'il faut innover et trouver des nouvelles façons d'entrer en contact avec les hommes gays bisexuels, donc pour atteindre les personnes qui ne sont pas diagnostiquées. Donc, en terminant, je vous invite à nous suivre sur Facebook pour en savoir plus sur nos activités de distribution de l'autotest du VIH. Merci.
Hello, bonjour. My name is Dylan Sampson. I'm the support coordinator at the AIDS Coalition of Nova Scotia. Myself and former and current coworkers have definitely had to take a lot of things into consideration given our organization's province-wide mandate. So some things that have been unique about our distribution experience has been that we've been already involved ever since the approval of the HIV self-test in 2020. So we've been involved with projects such as I'm Ready, with Nexus. In regards to prides, we have received funding from VIWH Healthcare in order to distribute to a number of prides in the region. We've also had other programs that could support our distribution. We were able to synergize really well with a partnership with SUAP and CBRC with the peer-in-peer program. So while we had the program, the members of staff and the outreach that they were doing, the distribution of harm reduction supplies by mail and in person, we were able to also provide HIV self-testing at the same time. So that was able to be quite a benefit. It allowed us to reach different populations that may not have otherwise been attending ACNS. Some of the successes we experienced included the marketing, and partnering with a national project did have its advantages. But we were also able to market I'm Ready and market Community Link as kind of a local context, a by us, for us campaign, and clients were very appreciative of the branding. Likewise, the media actually really took this in stride, and they promoted the project. They had us do interviews. We've been able to be successful on social media with it, which has actually helped boost distribution and boost the awareness of ACNS. We were lucky that we were able to provide options and choice. Because of the large urban-rural divide in Nova Scotia, not everyone can drive 3-4+ hours to get to Halifax to get an HIV self-test. So we were able to mail them out throughout the province, which has been very useful, and the majority of Community Link's participants use that option. Some barriers we experienced included that when it was launched in the winter months, it made it very difficult to do outdoor public outreach, which, given some of our previous outreach in the summers during Pride festivals, those were often the most successful times because people would be like, HIV self-testing, that's a thing? And one barrier that is more of a ACNS failing than a community links failing is that ACNS historically and currently has failed to adequately perform outreach to Indigenous ACB communities, other BIPOC communities, trans and non-binary people, and we're hoping to continue to improve and work on that. Thankfully, the Indigenous community is able to get support from Healing Our Nations, another ASO that has reached throughout the Maritimes, but we need to do a lot more work, and for that reason, the majority of Community Links participants in Nova Scotia identified as cisgender and white. Some things that we were able to learn about this program was the value of increasing the accessibility to HIV testing. So programs like Community Link make kits and testing a lot more accessible, encourages routine testing, it increases the knowledge and literacy of HIV and of HIV testing methods, and generally decreases stigma. But one important thing, especially in a maritime context, is that it increases awareness of HIV testing methods, because outside of Pride events, outside of national projects, outside of AIDS Awareness Week boosts, oftentimes point-of-care testing is very inconsistently available in Nova Scotia. It is usually just the lab test. And now, thanks to programs like Community Links, the self-test. Otherwise, we don't really have that kind of access to rapid testing and easy testing. People have to wait weeks and weeks. Thank you very much for your time and for having me.
Wow, isn't that amazing? So first, a round of applause for everyone. You know, as we were working to sort of put this all together, it was little chunks in here and there and meeting, but these guys are pros, they're champions, they're doing amazing work. We're going to open it up now to questions, and we have mics here up on the stage, so please use the microphones. We'd love to have you interact with folks here. You can see how, ask questions, make comments. Who wants to go first? Come on. Questions? You gotta have them. Here we go. Just needs one person to start us off.
All right, I'm like the fish out of water here anyway,
There you go.
so I'll go
Perfect.
first.
Thank you.
Hamish Shaw from SRX Health. I'm also a hepatologist in Toronto. First of all, let me say that was very inspiring, and I'm very optimistic for the future of HIV testing thanks to the work of all of you. I assume I'm older than most of you, and so great to see young people really taking this forward. I had a question. I think, Kyle, you mentioned this around pathways to care, linkage to care after testing is done. And I was curious if some of you wanted to share your experiences around how you're building that aspect of the care continuum into the testing programs that you've designed. Thank you.
Is this on? Okay, hi. Thank you for the question. So yeah, I briefly mentioned it in mine. We were kind of thinking about that when coming up with a plan for outreach. So we basically put a phone number on each and every kit, which took time, but we had really dedicated and helpful peers that went through and put like stickers on each kit, and the sticker was a phone number, and it basically, if you call it, it takes you to the like an HIV counselor that we have that works at our clinic at Women's Health in Women's Hands. And if you call it, she's there to help you with any questions you have regarding pre-testing, post-testing, or just anything related to HIV. So that's basically the steps that we took at Women's Health.
So yeah, I'd like to add to that. At CIRC, we've developed info sheet relevant to our local context. So offering people information about who to contact and what to do if they do get a positive result. We've also I had access to a lot of the resources that CATIE provides, just offering general information. And to add what I was speaking to earlier, I guess my thinking so far has just been that having access to the kit, even if that's only what someone gets, I still think that's helpful and more important, to moving care along. So even if like someone isn't able to connect someone to CAHR or like they may not access it right away. Just having access to the kit is an important step. Thank you.
I know for my part, networking has been extremely important, whether it is finding culturally appropriate services. So like I mentioned, Healing Our Nations, if someone is a member of an Indigenous community, giving them community-focused care that maybe I cannot provide as a settler is really important. Or when we were distributing the kits, anytime someone came in person, I threw my business card in the bag. I ran out so many times because it was just like, call me, any questions, anything. And being able to know HIV specialists across the province, so okay, you're living Cape Breton, that's 3 hours away, you don't want to drive to Halifax every time. Getting someone in touch with the HIV doctor there is really important. And kind of making the information as accessible as possible, like throwing in pamphlets, here's what ACNS does, here's what Healing Our Nations does, here's what Mainline Needle Exchange does, like all the different organizations, and even giving people a connection to CAHR if they if they test negative, being like, okay, what are we going to do to help you feel safer and more empowered in terms of HIV prevention?
I don't think the question was directed at me, but this is, I skipped a slide, and this was something that we learned through the distribution of the kits. In Ontario, there are several places, well in Toronto, there's several places where you can get POC testing, there's like different types of testing you can do, but I feel like this kit is actually like reach people who've never been tested before. A lot of people who are first time, you know, people who are testing for the very first time, knowing that there are other options available. So I think that's really important. I think having the autonomy to like take the test and decide when you want to be connected to CAHR is really important, rather than you know, we know that connecting the people to CAHR is very important, but people have to be ready, right? And people have to be like willing, and I think this test gives people a little bit more time, space, and just confidentiality, like to kind of take their health into their own hands.
I'll just add to that really quickly too, that people are taking it in real time, particularly in bathhouse settings. So often they're leaving, doing the test, and coming back 3 minutes later and accessing myself.
I just want to say that, I hope it's on. I just want to say, like, you know, because of education and awareness, it's very important. It's not just, you know, handing out a HIV self-test kit, but the education behind it and the awareness, so that people know. And what we do also, along with our HIV self-test kit, we provide, you know, a card which says, you know, positive on one side, what to do. If it's negative, what to do. And then there's also another card that provides, you know, counseling information. And because of our, you know, our needle exchange and our that interaction with the people in the needle exchange and our client care coordinator, we have a very good relationship with the people who are using the needle exchange, and then they trust our services so much that they can come back, and, you know, and again, that education is very important, so that they come back. They trust us to come back and, you know, to follow up on that, you know, continuous, the continuum of care.
And I'll just add a little bit to what has all been said. So at Ribbon Rouge as well, we know that education is very important. In as much as we do it in an engaging and interactive way, we throw in resources as well. And each test case too, we put a sticker with our contact number. And one thing that is also helping for us is anonymity. When we started, we realized was a challenge and a barrier. And the location of our office, so we were very strategic. We got an office space in a place where there are multiple offices, businesses in that office. So if you enter that building, even though Ribbon Rouge, we work on HIV, it's not because of HIV that you are entering that building. So that gave community members kind of the confidence and to feel safe, because they know they had a safe space to seek support and services in case they test positive as well.
Yes, good. Wonderful. Please.
Good afternoon, everybody. Just as a comment, and then I want just to say thank you so much for your presentation. And thank you, Dr. Sean Rook, So this platform and this intervention and implementation to bring the HIV self-testing is good in our communities. I'm here to also to support ORIT because I work with her in the term of to be a peer HIV testing distributor. So as HIV positive woman, I come from Toronto. So I started to distribute this, but I feel myself, this is not a Chantal I know, because I will just distribute a kit. So I try now to bring back my power to stay the storytelling, to speak about my status in front of the people, and to know the importance to be testing. Because before, as a speakers bureau in the communities, I was talk about my status to prevent people, to make understand there is a difference between HIV and AIDS, and they show my face to change the world. But after I said no, I wanted to do that before I distributed the kit, and to tell them, really, this is your choice, voluntary to be testing, because if you know you are HIV positive, you will have a support. If you're not HIV positive, you will know how to prevent yourself. So what I call it, I save someone's life because of my status, and then I told them, you know, you can live longer. I'm HIV positive for 28 years. So it means because I go to HIV testing and I start to move forward with my life, take medication, have services, have education. So that is my strategy plan with Women Health, Women Hands, how to distribute the kit, and then now I distribute a lot of kit without any issues or challenges. So thank you so much, and thank you, Dr. Sean O'Rourke.
Thank you, Chantal. We'll take a question. You guys are fine. Go, please.
Sulma Rueda from the University of Manitoba. I just wanted to thank you. All the presentations were phenomenal. I love when we can hear from all of you, frontline, let's say, workers that face this problem. I just have two questions. How you deal with some of the places work in anonymity? So how people were linked to CARE and connect to CARE? And the second question is how you deal with all COVID restrictions. I just want to learn from your experience of how to overcome those kind of challenges. Thank you so much.
Just linking to CARE and facilitating CARE.
Okay. Yeah, I'm happy to try and answer the first part and then the second part. So, I mean, within the medicine bundle, we were very intentional about making sure that there was always going to be somebody on the phone if somebody was going to be calling in, and that if we were directing folks, that one of our trusted messengers or our peer navigators were going to be on the other side of the phone, or being able to connect to CARE right away. So we used open phone, but there's a number of different services out there that folks can create phone numbers and utilize within their networks or their peer networking team, trusted messengers team, to have access to a number and to a person right away. In BC, I mean, we were in a very unique situation. I'm a registered nurse and I work in sexual health care and do sexual health testing, so I was the main contact for the medicine bundle. So it's very difficult to completely replicate this in other communities necessarily, because a nurse may not be the lead on the team or working with it in the team. Suggesting that should be maybe in the future as we increase nurses. But having me there was able to connect directly to CARE, and then I was able to connect to some dedicated physicians that are in the room or here during this week who were able to be available to community whenever they needed. Again, that relationship is quite unique. So it's all, I believe the success of the medicine bundle truly is because of the relational approach that we took. We spent years, which is difficult, to send and build those relationships in community and with service providers, so that when we did launch, folks had direct access to CARE. That being said, it's not that easy, and it can take time. And the second part, I mean, during COVID, we were intentional about making sure we provided as many resources in the medicine bundle kits, so folks could order a medicine bundle, as well as other educational tools and things. So we were shipping them directly to their home, so they didn't have to come pick them up. But that was difficult sometimes if folks lived in more remote communities and if it took weeks potentially to get to them. There was worries about the self-test kits, of course, and temperature and a number of things. But trying to limit, during COVID, it was limiting access or limiting interactions personally.
I can definitely speak to what it's like without a healthcare provider directly in the ASO. I am the only person who interacts directly with clients. Social work is my field of study, so we would have to interact with other organizations for confirmatory testing. We would have to interact with other organizations to get connected to treatment. But thankfully, being able to build networks, I have the nurse at the clinic on speed dial. I have people from the sexual health centers on speed dial, on Facebook, on Instagram, everywhere I can get them connected. And so often I am the person that people will ask questions to, because I am the support coordinator, I am the client-facing person. So there is some anonymity there, and we discuss kind of how to maintain it as much as we can, how to disclose, how to have discussions about having an HIV scare. But of course, it is difficult because we can't directly provide some of these more advanced testing services or more specialized services because we don't have the healthcare provider. As for COVID, we made sure to get funding so that we have boxes of COVID tests available for clients, for anyone in the community who comes through the door. Masks, we continue to recommend masks when people come in. We continue to recommend appointments. We mail things out. If people wanted extra things included with their kits, like COVID testing, we'll make that available. And if not, people can very easily come in. I wear my mask when I'm at work. The rest of the staff often do as well. So it's kind of trying to maintain it, even though knowing that a lot of things have loosened up, but the pandemic is still ongoing.
Okay, I'll answer a little bit on the anonymity and the care process. So at Ribbon Rouge, we have a project specifically on HIV. So we are forming community of practice in 6 cities in Alberta: Fort McMurray, Calgary, Edmonton, Grand Prairie, Brooks, and Lethbridge. So what we do is the community of practice. We have members with lived experience, ACBs with lived experience as community research associated to be peer navigators. We also have medical professional. We also have social workers. We also work in partnership with Alberta Black Therapy Network. So what happens is if somebody tests positive, the social worker gets in touch with the person if they come to Ribbon Rouge and refer to our community of practice members, who are made of people with a lot of background and a lot of experience in terms of providing care and support for people. And most often we've realized that the people with lived experience are really champions. They are very brave, and they really know how to navigate the systems in terms of gaining trust. We realized that for community members, trust is very important because of the stigma. So relationship building is the core of Ribbon Rouge. Once we have that relationship building, especially with our peer navigators with lived experience, that are really amazing when they come, because they've been there, they've experienced it, and they have navigated the system before, so they are equipped to offer that support to gain the trust for the social worker to refer the services to our community of practice members, which are made up of medical professionals and psychologists and counselors and all that. So that's the approach that Ribbon Rouge be currently using.
So one of the things with APSs is, I know in the past, like when our nurse has, done the confirmatory testing, and the person was then referred to the infectious disease clinic. So I've seen nurses coming from infectious disease clinic and then picking up the person, the individual, and then they're connected to care. So we also support we have about 172 people with HIV, living with HIV that our client care supports. So it means like, taking them to doctor's appointments or to pharmacy visits and, nutrition, providing nutrition. We also have 6 people on DOTs, which is called direct observed therapy. So they are observed literally, taking their medication just so that they can achieve that U=U. So that continuum of care is provided at our organization.
I think I missed part of the question, but I have something I'd like to share. So CATIE had hosted some webinars on the self-testing program. And in one of those, I heard something that I found, I really liked it. So someone speaking in one of those webinars compared the HIV self-test kits to the availability of pregnancy tests. And those are something that you can literally go buy in a dollar store. And I see value in having these kinds of kits available in that way as well. So I just thought that was a very neat thing to think about, just the similarity to the availability of pregnancy tests.
Sorry, wanted to add one more little thing about the anonymity side of it. Sometimes you can just think of the really little things. Like when we send out mail, our mailing labels do not have our organization's name on them. They just have our address, and we're in a building with multiple offices. So it's just such and such place, such and such street. And we make a note on the form for the self-tests. Do you want, what is your address? You don't even need to give us your name. So it can just be resident of this, and it's just a blank envelope. Or when you're in person, and it's been something I've had to improvise and learn about, is we used to just use red reusable bags. Red isn't a common color in shopping centers, so it's very obvious. So we ordered a bunch of different colors, so making sure that we have something that can kind of look like, oh, someone's been shopping, rather than, oh, they went to that place for hygiene supplies because they're income insecure, or to that place because they're testing for HIV, which can be very stigmatizing. So trying to kind of ensure the anonymity that way, whether it's just even making sure how you send out your mail, is actually surprisingly good at helping people even feel less stigma to ask for kits.
Terrific. Okay, over to that question. Thank you so much.
Hi, Lane Boners, Two-Spirit program at CBRC. Thank you, everyone. I just wanted to ask a quick question because a lot of the face-to-face peer support seems to still be limited to urban centers. I'm wondering if there's any conversations around how we can reach rural and remote communities more, areas that may not have population-specific, sexual health-specific or HIV-specific resources within their own community, and if anyone has any idea on how many of these tests are actually leaving the city, in a sense.
Thanks, Lane, and thanks for the questions. I mean, I can speak to the medicine bundle. So the way the medicine bundle was rolled out, as I said in my quick presentation, is through consultation, and then we launched a pilot. The pilot was 3 months long, and it took place last summer. And through that pilot, at the beginning, it was quite slow. We were doing a lot of sharing and conversations in community, but we're just sending out a couple tests a week, mainly outside of the greater Vancouver area. By the end of the pilot, we were sending out 10, 20 medicine bundles a week, which includes 2 self-test kits. So, and then the pilot ended, and we realized that there was still a demand. So between the end of August to the end of November, there was a lot of folks reaching out saying, hey, we want these medicine bundles, we want these medicine bundles, we want access to self-testing kits. So on December 1st, I think, or December 2nd, I forget which exact day we launched again, but we launched it again as a program, and since December, we've sent out almost 400 medicine bundles. So we're well over 1,000 HIV self-test kits gone, mainly outside of the greater Vancouver area. We mainly started in BC and rural and remote communities throughout BC, but we've actually now shipped to, I think, every province and to Nunavut and the Yukon. So we're just missing NWT right now, but we've been providing medicine bundles across all of Canada, which is great. So, and we're hoping to have further conversations about increasing that. But of course, that'll take more conversations and relationships to build with Indigenous folks across the country.
Yeah, thanks, Lane. I guess one thing is, in the near future, it's unlikely that we're going to have in-person peer support available in each rural community across the country. And so as we make joint efforts in order to reach people, provide access to HIV self-testing to people living in some of these communities where there's not even confirmatory testing available, I think we're going to have to rely on some shared peer navigation support services that are available digitally. And I think that's not the same necessarily as having somebody face-to-face, but I think that we need to have more discussions around how we can help close that gap. But for now, I know groups, I think like WHIWH and CBRC are providing that nationally through like teleservices and digital supports and whatnot.
Yeah, it's really important to be able to do outreach to rural communities, especially given how much of a divide there can be. I think about my own upbringing in Nova Scotia, where even to go see a more specialized dentist, it took 2 hours. To get anything beyond a basic doctor's visit, an hour minimum. And that's like out of I grew up in Cape Breton, leaving Cape Breton to go to the mainland to get anything more specialized than going to see my GP. And some of it is doing, like with my organization, will be, for example, for prides, we're actually looking at doing smaller, more rural prides in communities that are not Halifax, frankly, and trying to do outreach there, bringing tests with us, working with organizations in other parts of the province, partnering with them and doing testing events. Or with some of our media presence, actually, when I did an interview about one of the projects, it was a CBC Radio-Canada interview. I was interviewed in French, and that actually could potentially reach smaller Acadian communities scattered throughout Nova Scotia as a cultural and language minority, that most Acadian communities are very rural. So that is a potential way to reach these communities, is actually to speak their language, to have someone who is able to represent them. Yeah, honestly, ACNS was just lucky that they had a francophone person there to do the interview in French, because I was the only one.
Terrific. We're going to take one more question, but just a comment, and then I'm going to. So, for sure, the telehealth kind of options and Test at Home and the other programs that REACH runs, there's a Get a Kit programs. Actually need to use technology to get to people that aren't where people might have agencies that are nearby. So with that, we'll take one more question. I will just ask the roundtable champions to think of one last thought, because I'm going to ask them just in our last 5 minutes after we take this question, just one last comment for all of you. So question, please.
Yeah, Patricia Maecha from Communities, Alliances and Networks. Congratulations for the job that you are doing. One of the main reasons for self-testing is to reach people who are HIV positive, but they don't know. So what is the percentage in your organization that the people came back with a test with HIV positive? What percentage? Do you have this information?
So you heard a little bit from folks. I think maybe we'll turn.
Yeah, sure. I'm happy to share. So CBRC, we do give people the option to complete a 2-week follow-up survey where they can report their result. Only a small percentage of people actually completed that survey. Of that group, 2.3% did report a reactive test result. However, we don't necessarily have the pathways to determine whether or not that's been confirmed as positive through confirmatory testing. So there's always a chance that it could be, a poorly read result, or maybe, an inaccurate result. So yeah, it's a little bit challenging. I know some research programs do have more pathways in order to find out that information, but we always look at the balance of things, like collecting more information from people and that potentially getting in the way of them accessing the test. And so unfortunately, by trying to make it lower barrier, we don't necessarily have access to some of the detailed information that we'd like on that front.
That's right. And Shawnee, you mentioned that there was 4 cases.
Yeah, among all the self-test kits that we'd given out, we did notice 4 people who had taken the test kits in the needle exchange come back for the confirmatory testing. And we were also told, and from the stats, not the nurse told us, but from the stats, there were a few positives that were recorded in the last 2 months. And again, they get connected to CARE, and a lot of them, if they are a hard-to-reach population, then it gets referred back to our client care coordinator.
But it's pretty clear for everyone, these are the trusted sources here, so that as this program moves forward, people are going to start coming back, and these doors are wide open. So with that, thank you so much for your questions. I'm just going to let the panelists here go across and just, if they have one last word or two to share with you, and then we'll have to close. And there will be more opportunities to hear from them, because we're going to be setting up webinars to hear and dive deeper into all the things that we're learning and these best practices that they're developing. So with that, I'm going to start with, on my left here, we'll just go across. Anybody wants to jump in with a thought or two, and then we'll close for today. Thank you.
I'm running out of thoughts. Okay, so I think one thing that we've learned from this is that community is responding really well to HIV self-testing, and it's really incumbent on us to ensure that we continue on this path forward, both the funders at government, our healthcare partners, and community-based organizations like these standing up here today.
Yeah, just to echo what Brooke said, community, especially in regards to the medicine bundle, is responding very well to access and to working together to challenge stigma, but that is done through the relationships that took a while to make. So really reinforcing the need to build relationships with community to continuously challenge the stigma and shame that is around HIV self-test kits and overall testing. So really working towards normalizing sexual conversations, normalizing sexual health, normalizing sexual activity in all beautiful forms is really a passion of ours at CBRC, but also a passion of ours in the Two-Spirit program to build those relationships, which is important.
So I like to say safety, not stigma, and also to emphasize and echo the thoughts that has been shared already. Community relationship is very critical, and it's very important and necessary, because we are seeing a reception of the community in terms of first testers, which is very encouraging and positive. So I believe that this is the time we need to come together as one, regardless of background, come together, support this initiative, support the services, and also funding is very critical, because without funding too, it is so difficult to penetrate into this. Into the system. So we plead to the government to continue sponsoring this project, because we can see the impact in our community, and we can see the stories, and we can see that. So let's get together to do this.
Yeah, so I would just like to say that, how important the education and awareness is, and as I'd compared, with the 2021 pilot project, we see how, receptive to accessing the HIV self-test kits is among the First Nations community, and that's a step. That's a small step that we've made. Like, there was so much stigma back in 2021, but continuous conversations and education has helped to reduce some of the barriers, and that's what's important. Reducing the barriers, having that relationships with the people, breaking down the stigma, and and then trying to provide that connection to care, making sure that people know their status, and once they know their status, they're connected to care, and it's not a death sentence. People can live long lives with HIV.
So CERC Manitoba Services provides sexual and reproductive health services across the whole province. We have our office in Winnipeg, which is where I work, and we have an office in Brandon, and we have a staff that works in Flin Flon, which is in northern Manitoba. So just thinking back to Lane's question earlier, I'm hoping to continue to work with my colleagues to promote and extend our reach in incorporating the HIV self-test kits into all of our programming. We've just signed on our Brandon office to the Community Link program, so they're going to be upping their distribution. And Brandon is still an urban center, but a lot of rural folk access service there. CERC provides, I think, like the only 2S LGBT services within that part of Manitoba. And then, yeah, there's another thing I wanted to mention is there's 3 different programs I'm aware of that folks can order by mail, the self-test kits individually, which is through CATIE, CBRC, and then through organizations that are registered with Reach Nexus for Community Link. So I'm hoping to move forward with using CIRC's Reach to promote that and invite individuals within our network and within Manitoba to order kits that way to increase accessibility of them. And yeah, just generally being a part of the Community Link program has been really rewarding personally, and I think for the organization, because like people love getting free stuff. So if you can give things out, like that's really good for building relationships.
Thanks, Carl. We gotta move on.
Thank you.
Sorry. I'd also add, like, I'm Ready is also another platform where folks can like order up to 3 kits and get connected to like a peer navigator. That wasn't what I was gonna say though. I think that I've worked in the sector for a decade, and I've worked in collaborations with health centers that do on-site testing. We've done tons of referrals to testing, POC testing, or other types of HIV testing. And I feel like I've never seen, I feel like with the Community Link project, it's significantly improved the access for ACB communities in Ontario. And yeah, I'll go to an event and give out close to 100 kits at one event. And that's something I haven't been able to do for a really long time. And I find that when I go back to some of these like clinics or wellness events, people are more likely to take a test through word of mouth referrals. So that's been really great. And yeah, funding would be awesome to be able to continue the distribution of these kits for sure.
Hi, I'll keep it short. Yeah, just to echo what my colleague here, Mary, said, I think it's really important, especially for the ACB community. Usually they're left out of, you know, having access to these types of technologies. So I'm really happy to be part of it. And I think this Community Link program is just so amazing. To echo my colleague Chantal, it's saving lives, and I hope we can keep doing it. It's only starting now, and we've already distributed like so many kits. So yeah, I'm very happy to be part of it, and I hope we can continue.
I guess I would just say, don't wait for people to come to you for the test. That's the old way of doing it. Bring the test to the people.
J'aurais pas mieux dit que mon collègue Michael ici, mais pour de vrai, Community Link, c'est vraiment une façon accessible pour tout le monde d'aller vers les gens, puis de continuer avec ce programme-là. Je pense qu'on va être capable d'aller de plus en plus sauver des vies, puis sauver des gens qui n'auraient pas pu savoir avant de se faire dépister de cette façon-là.
Ça fait plus de 30 ans que Réseau existe. Je pense que je peux parler pour tout le monde chez Réseau en disant qu'on est vraiment très heureux puis très reconnaissant aussi de pouvoir participer à ce mouvement-là, vraiment de rendre plus accessible l'autotest pour le VIH. Donc, puis je fais écho également à tout ce qui a été dit précédemment concernant le financement puis le fait de vraiment apporter les tests aux personnes là où elles sont.
Education is really important, but it's not just educating the community. Often I've found that HIV circles, any news about anything with HIV, anything about testing, often only gets shared between various people in the various circles: sexual health, substance use, sex work. All of those organizations know, but we need to teach healthcare providers. We need to teach governments about why giving us money is important. It's about teaching funding bodies why year-long funding contracts, maybe you could do more than 1 year, but in general, kind of the education isn't just educating the community, because I need to not explain to a nurse on Facebook what the HIV self-test kit is just because they saw a picture. Or having to think about how, like, needing to educate people to also advocate for funding, advocate for education, advocate for government involvement or healthcare system involvement. My province doesn't have rapid point-of-care testing unless it's with, like, an approach study. We only have the lab testing, and thanks to Community Links, the self-testing. So kind of needing to educate and advocate, and not just in our own circles, but somehow getting it to the people who actually need it most, which is our bigger systems.
Thank you so much, Dylan. So on behalf of everyone here, thank you all for coming, participating, engaging with us. Thank you, CAHR, for having us. And one last applause for these champions. Thank you. Good job, guys.